Etodolac, also known as Lodine, is a nonsteroidal anti-inflammatory drug, NSAID, that is used to relieve pain, swelling, and joint stiffness from arthritis. It works by blocking your body's production of certain natural substances that cause inflammation. If you are treating a chronic condition such as arthritis, it's important to talk to your doctor about non-drug treatments and using other medications to treat your pain. The recommended daily dosage of Lodine varies depending on the condition being treated, so it's essential to follow your doctor's instructions. It's best to take Lodine with food to help reduce the risk of stomach upset. Always take this medication at the same time each day to maintain a consistent level in your body. Before taking Lodine, make sure to read the provided medication guide from your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 4 times a day with a full glass of water. Do not lie down for at least 10 minutes after taking it. If stomach upset occurs, take it with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. It may take up to 2 weeks of taking this drug regularly until you get the full benefit, especially for arthritis. If you are taking this drug as needed, remember to use it at the first signs of pain for the best results. And always tell your doctor if your condition gets worse. Some common side effects of Lodine include upset stomach, nausea, diarrhea, gas, weakness, drowsiness, dizziness, or blurred vision. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that Lodine has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. Lodine may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Be sure to contact your doctor immediately if you experience any serious side effects, including changes in hearing, mental or mood changes, easy bleeding or bruising, difficulty swallowing, or symptoms of heart failure. In rare cases, Lodine can cause serious liver disease, so seek medical help right away if you experience symptoms such as continuous nausea or vomiting, loss of appetite, stomach pain, yellowing of the eyes or skin, or dark urine. While a serious allergic reaction to Lodine is rare, it's important to seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching or swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. Nonsteroidal anti-inflammatory drugs, like Lodine, may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk is higher in older adults or those with heart disease, high blood pressure, or diabetes. It's important not to take Lodine right before or after heart bypass surgery. Lodine may also rarely cause serious bleeding from the stomach or intestines, especially in older adults. If you experience stomach pain that doesn't go away, black stools, or vomiting that looks like coffee grounds, seek medical help immediately. It's crucial to talk to your doctor or pharmacist about the benefits and risks of taking Lodine. And remember, always follow your healthcare provider's instructions on dosage and timing. Before taking Lodine, it's important to talk to your doctor or pharmacist if you have any allergies to Etodolac, aspirin, or other NSAIDs. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so be sure to discuss this with your pharmacist. It's crucial to inform your doctor or pharmacist about your medical history before taking Lodine, especially if you have a history of asthma, blood disorders, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. Kidney problems can also occur with the use of this medication, so it's important to stay hydrated and report any unusual changes in urine to your doctor. Lodine may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. Additionally, daily use of alcohol and tobacco may increase the risk of stomach bleeding, so it's advised to limit alcohol and stop smoking while using Lodine. This medication may also make you more sensitive to the sun, so it's important to limit your time in the sun and use sunscreen and protective clothing when outdoors. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using. For women of childbearing age, it's important to discuss the benefits and risks of using Lodine with your doctor. This medication may harm an unborn baby, so it's not recommended for use in pregnancy after 20 weeks. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time and avoid using it after 30 weeks of pregnancy. It is also important to consult your doctor before breastfeeding while using this medication. When taking Lodine, it's important to be aware of potential drug interactions. This means that Lodine may interact with other medications, which could change how they work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Lodine include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics such as furosemide. It's important to be cautious when taking Lodine with these medications, as they may increase the risk of bleeding when taken together. Additionally, it's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Lodine and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking it unless your doctor instructs you otherwise. Finally, Lodine may interfere with certain lab tests, possibly causing false test results. It's important to inform lab personnel and all your doctors that you are taking Lodine to ensure accurate test results. If someone has taken too much Lodine and is experiencing severe symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include severe stomach pain, slow or shallow breathing, and extreme drowsiness. It's crucial to get help right away if you or someone else is experiencing these symptoms after taking Lodine. It's important not to share your Lodine medication with others. Your doctor may also schedule lab and/or medical tests to monitor your progress, including complete blood count, liver/kidney function, and blood pressure. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Lodine, making lifestyle changes such as weight loss if needed, and doing strengthening/conditioning exercises, may help improve your flexibility and joint function. Be sure to consult your doctor for specific instructions on how to incorporate these changes into your daily routine. If you are taking Lodine on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take your next dose at the regular time. Do not take double the dose to make up for the missed one. When it comes to storing Lodine, it's important to keep it at room temperature and away from light and moisture. It's also essential to store it in a place that's out of reach of children and pets. When it comes to getting rid of Lodine, it's important to not flush it down the toilet or pour it into a drain unless you've been instructed to do so. When the medication is expired or no longer needed, it's best to consult with your pharmacist or local waste disposal company on how to properly discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.